Okay, great. I'm going to go ahead and start while we're waiting for Katie to also join. So first, thanks. These discussions have been fantastic. And I'm going to, given the time, I'm going to say just a couple of very, very short things and then introduce our first panelist. It's great to see you again. I was not here for Rebecca's panel this morning, but I did quickly want to bridge this to the panel that talked about cost earlier today. So we spent some time, I think, this morning talking about the cost of various types of outbreaks. We're going to be talking in this panel about national preparedness, which obviously has its own costs, but we're looking here at cost benefit, how to make those arguments better, how to really understand preparedness, what it costs and what it saves. And I'll just start briefly by saying 5 quick things. First, just to get everybody's head into this space, we know that outbreaks cost a lot. There have been lots of different estimates. I'm speaking to many of the people who made those estimates. We also believe that preparedness costs less. Some of us think that we know that preparedness costs less, but I would say believe because I think that not everybody has the same frame of reference for that, and hopefully we'll have some conversation about that today. In 2014, when we had the Ebola epidemic in West Africa, which Dr. Nyenswa was in charge of overseeing the response for in Liberia, we didn't have any way of really understanding how much preparedness cost, at least in terms of the international health regulations, which we'll be speaking about today, along with the veterinary equivalent, the performance of veterinary services pathway. We didn't have much money in the system for epidemic preparedness. And we knew that about 70% of countries in 2014 still weren't prepared to implement the IHR, but we didn't really understand that number because we didn't have common metrics. Now we have some common metrics in the form of the Joint External Evaluation. We have about 70 or more countries that have been assessed, with about 100 in the pipeline, but we have a bunch of challenges, and I think we're going to hear about some of those today. They're voluntary, understanding the cost benefit, how much it costs and costing. We just heard from Mukesh, understanding the cost is challenging. What are the incentives and the accounting and accountability for improving preparedness? And then also, what kinds of mechanisms do we need to have in place to actually fill the gaps and to pair those incentives that we hope that we can do a better job at creating with the actual gaps that we have? So with that frame of reference, I want to introduce our first panelist. Mr. Tolbert Nyenswa currently serves as the first Director General of the National Public Health Institute in Liberia, which was established in 2017 following the 2014 through 2016 Ebola epidemic. And he was also, as I mentioned before, the incident manager for Liberia's response. He was also the first Deputy Minister of Health for Disease Surveillance and Epidemic Control, and has worked in the health sector in Liberia for the last 18 years, including overseeing many issues, but major gains in malaria control among them. And he has received numerous awards, but including one that I'll mention here, which is Liberia's highest honor, the Grand Commander Order of the Star of Africa, which he was awarded by President Ellen Johnson Sirleaf. So with that, just thank you for everything you did for the world, Tolbert, and we look forward to hearing what you have to say.